Hello, everyone, and welcome to our first staff town hall of 2021. I wish I could see your faces, but it is great, nevertheless, to be with a great group of staff today. I'm Hallie Nicholson, HR Strategic Communication and Engagement Manager, and I'll be your moderator for this town hall. So today we've got a great group of panelists on hand to answer your questions. Some of the questions will be the ones you submitted before the event, and we're also taking questions in the Q&A box today. And we'll have folks answering questions both on screen and in writing via the Q&A box, so make sure to check both of those. Due to our time limitation, we will likely not be able to get to all the questions that were submitted today, but we'll log the questions and we'll put some answers to the most frequently asked questions on our Return to Learn site, and you can check the chat for a link for that. Before we get started, I want to note that this webinar has live closed captioning available in two ways. So first, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is pasted into the chat right now. So without further ado, I'd like to introduce Executive Vice Chancellor Elizabeth Simmons for some welcoming remarks.
Thanks very much, Hallie. It's really a pleasure to help kick off today's Return to Learn Town Hall for staff as we discuss the latest developments related to campus operations, including how we're safeguarding health and safety. Now, the COVID vaccine is a topic that's really on everybody's minds nowadays, and Dr. Chip Schooley will fill you in on the current plans for distribution. But first, before we go to the panels and the details, I'd like to just start by thanking each and every one of you on our staff for your ongoing support of your fellow Tritons and your dedicated teamwork and collaborations with one another. The compassion and the ingenuity and the resilience that you have been demonstrating have been what's made it possible for UC San Diego to uphold our mission in this very challenging time, and also have made it possible for us to identify opportunities to further assist the broader San Diego community. So it's truly an honor for me to serve the university alongside you, and I wanted you to know that. So today we've received many questions from you. We will answer as many as possible this afternoon. Also, I just wanted to distinguish, there may be some questions for which we do not yet even know the answer at this time. So we appreciate your continuing patience and flexibility as the pandemic evolves, as the public health regulations change, and we will answer every question as soon as we just know what that answer is or what it's going to be for the future. So please do visit the Return to Learn website frequently to see the latest updates. That's returntolearn.ucsd.edu. Answers to frequently asked questions are there. They're the latest campus updates, and lots of great dashboards nowadays with huge amounts of information. So now let me return the floor to Hallie to start the next part of the program.
All right, great. Thanks so much, Elizabeth, for those opening remarks. I would now like to welcome the host of today's town hall and our Chief Human Resources Officer, Nancy Resnick.
Thank you, Hallie, and good afternoon, everyone. I'm Nancy Resnick, and I am proud to serve UC San Diego staff as your Chief Human Resources Officer. It is great to have so many colleagues joining us today. I understand we had approximately 1,300 folks register for this town hall. And so we know, and as we heard from EVC Simmons, there are many questions about the state of the pandemic, and you're looking for information about the vaccine. We are indeed so fortunate to be joined today by distinguished medical experts in our UC San Diego health community who can answer many questions and provide many updates. And at the same time, I want to note, as we heard from Elizabeth Simmons, that we really are in a very rapidly evolving and changing public health landscape. So we will continue to update you as new information becomes available. We will share it. But please know there may be times when we are going to be revising information, updating, changing course, and we will do all we can to keep you apprised of all those changes and all the answers to your questions as we're able to provide them. So it's been now over 10 months we've been going through this pandemic together. I continue to be so impressed and truly incredibly inspired by the way our Triton community has come together, the way we support each other and our campus community. Staff continue to be the mainstay in keeping campus operational and in supporting our students and our academic community. Thank you for all you do to support all of the ways you support our institution, and know that your work truly is valuable and makes a difference. Over the past 10 months, we have made different kinds of adjustments and sacrifices to keep ourselves and our loved ones and our communities as safe and healthy as possible. The steps we've taken together include many things: working remotely, adapting to stringent new safety and hygiene protocols. We're completing the daily symptom screening, wearing masks, getting tested frequently, and more. And these measures are paying off. Through these measures and innovation through our campus and our collaboration with our health partners, our Return to Learn program has been remarkably successful. We are regularly receiving accolades and acknowledgement in the media for the incredibly thoughtful and innovative RTL program. And as a staff member, each of you are a big part of the reason for that program's success. So thank you again for persevering. With that, let's get started. Back to you, Hallie.
Great, thank you, Nancy. So we're going to get started today with some information about just an update on the state of the pandemic. So I'd like to welcome our first presenter, Dr. Chip Schooley. Chip is a professor in the Department of Medicine and the Division of Infectious Diseases and Global Public Health. So take it away, Chip.
Thanks very much, Hallie. I too would like to welcome everybody today and thank you for all the things you've done to make it possible for us to be here and carry on. I'm going to run briefly through things that I think you can't escape if you have CNN as part of your Spectrum package, and spend more time later in the hour talking about the vaccine rollout. The country has been in an explosion of COVID cases since mid-fall that has risen steadily and only dipped during Thanksgiving and Christmas when testing frequency declined. To see after each of these great mixing events a resumption of the explosion in cases, to the point that by the beginning of 2021, we were seeing up to 250,000 cases a day. As you can see, there's a bit of a downturn lately, and I think this is both real and it's good news. Next slide. California has been one of the unfortunate leaders in this recent explosion of cases. And as you can see, we too had a rapid roll up in the fall with big increases in cases after both Thanksgiving and Christmas. Recently, a bit of a downturn. Next slide. Southern California has also been very busy, in fact, busier than most of California. These are the cases from San Diego. If you just look at this, you can see that we were up to 4,000 to 5,000 cases a day in San Diego, with a total case count now over a couple 100,000. But you can see lately we've seen the case counts come back down to levels of 2,000 or so, and I think we're headed down further over the course of the next several weeks, in large part because of some of the changes in people's interactions with each other, and as we begin to see things subside from the winter break. Next slide. And this is the last slide I'll show. And if you just look at the left panel, you can see the percentage of people testing positive in San Diego, which had risen to as high as 14%, but was as low as 3% at the beginning of November, is now falling as at 12%. This decline in test positivity rates usually precedes decrease in hospitalizations, and then that precedes a decrease in deaths. So I think we're headed in the right direction by a number of metrics. Dr. Scioscia will spend more time with you later going over some of the other data on this slide. Next. Now, one thing that's on the horizon I want to spend a little bit of time on today, you've heard a lot about these variant cases, or the spike deletion mutants, the new strains from England. And you've also heard that among the first places to have this picked up was here in San Diego, in the US. This is a cartoon of the so-called spike of the virus, and these are on the surface of the virus and allow the virus to attach to cells and enter them. This is the business end of the virus in terms of entry into the cell and allowing viral infection. People have been talking about the new variant, but in fact, there are several different variants. Many of them have the same features in common, but among the most common feature is at the very top of the slide, position 501, one change in one part of this spike that allows the virus to bind to cells more tightly and to infect the cells more efficiently, and also to infect people more efficiently. Next. What this has led to was first described in the UK. If you look at this over time, starting in July, August, and September, the blue line are the new spike deletion mutants. There weren't many of these circulating strains back until October. And then when they began to spread, you can see they exploded and overtook the strains that had been circulating prior to the advent of this new mutant. The reason this has happened is these are about 50% more efficient in being able to be transmitted in the population. And when they're both circulating the population, this one will replace the mutant, the previously circulating strain. Next. You can see here, just in terms of shades of purple, this mutant has taken over a good part of the United Kingdom. It has now been found in more than 20 different countries, including the US, where it's been found in 20 different states. Next. Now, one of the most important parts about this is that because it replicates more rapidly, we can find higher levels of it in the throat and in the nose. If you look at just the left two clusters of dots here, you can see what look like two clusters of circulating bees. And on the left side, you can see that the first column is lower than the right side. And this is the number of amplifications you have to do in one of the tests we use to measure virus to be able to see it in people who have the spike deletion mutant compared to the panel just to the right, the original mutant. The way this test is done, the lower the bar, the lower these dots are, the more virus is present. And you can see that there is substantially more virus present in people who are infected with this new strain. And the reason that's important is that it allows the virus to be shed in larger amounts and spread more effectively from person to person. Now, as I'll discuss later, we think these new mutants are currently covered by the vaccine strains that we have, although perhaps not quite as well. But we do have ways of adjusting the vaccine if we need to, and it would not be a reason not to be vaccinated. I just wanted to spend a little bit of time on this because you're going to hear a lot more about this over the course of the next week. And the take-home message is, yes, it's here. Yes, it's very likely to replace the strains that are circulating. And what it mainly means is we really need to double down on the things that we've been doing to have the progress we've made over the last several weeks in decreasing cases both in San Diego and on campus so that we can continue to have the case rate go down. And that means being assiduous about masks, staying out of crowds, not being in rooms where other people are without masks other than our own families. Next. Now, everyone knows, has heard many times that we have had what we think is a very successful program in controlling virus penetration of our communities, both on campus and off campus. And this is a very broad team-based effort that has utilized the science of this virus as it has come out to put together three main pillars. We have multiple ways of finding where the virus is, virus detection, that includes the testing programs that you know about. We have been looking in wastewater to find virus in wastewater draining dorms and soon, and also in research buildings. When we find people in the center column, we intervene and get them out of circulation so they don't infect other people. And if people have been exposed, we protect them from being able to become infected and infect other people by offering quarantine housing and having people stay home if they're not part of the student body. And then finally, risk mitigation, key among these wearing masks. All of these things go together. Next slide. And what we call a Swiss cheese model, in which any one of them would help but all of them together, because they are synergistic and add to each other, are extremely effective in keeping us away from the virus and have helped us be able to maintain campus operations as effectively as we have over the course of the last 10 months, for which all of us thank you. Now I'll stop here and move on. Next.
Hi, it's Angela Scioscia, and I'd like to just review some of our efforts at detection. I think we're back to keeping in mind all the basics and some new things we have for you in testing. Do your daily screening. Please identify any exposure or symptoms. If you have those, you're going to get a yellow and a red thumb. We'll ask you to stay at home, and the COVID testing time will reach out to you, give you some clinical guidance, as well as instructions about testing. Testing is available same day, multiple sites. We have all the sites still available throughout San Diego, as well as the Price Center. Results are coming back in 24 to 36 hours. Average is 18 hours. So you'll get your results back very quickly. And we'll be speaking about wastewater a little more in a couple of slides. The asymptomatic screening continues. We want individuals who are coming onto campus for any reason to test at least weekly. And we offer that testing for those that are also working remotely. Our students living on campus or coming to campus for other reasons are mandated to test every week. Again, all the sites are wide open and available to you. And I want to talk about the self-administered testing, the new vending machines. New slide. Over the winter break, we had a new way of testing, and that is self-administered testing with access to the testing kits through vending machines. The vending machines are located throughout campus. Right now, we have 10 sites that are open for everybody, and 11th, which is a little more restricted, and there'll be more sites opening in the upcoming weeks. At each testing site, you'll see that we have both the vending machine, which has the kits, a hand sanitizer, and a drop-off bin. It's important to realize that the testing process is just a little bit different here than when you go to one of the other testing sites because of the identification to the sample to you as an individual. So when you approach the site, sanitize your hands, use the vending machine keypad to access a kit, pick up your kit, hand sanitize, then go to an outside area. And if you want to test right away, we think that's great. Or if you want to delay your testing to a more convenient time, that's okay as long as you do it within a few days and bring your kit back. After you've swabbed your nose, and there are instructions in every kit, it's pretty easy and people are not finding any problem with the testing, you drop it in the drop-in. I do want to emphasize that you identify the sample to yourself using your login. So you have to have the UCSD app. You have to scan the barcode and get confirmation that the scan has been successful. That step is really important so that when the lab gets your sample, it can associate the sample with you and not someone else. So very important to use your AD login only for you. Don't give your logon to someone else. That's not appropriate, and that will create clinical problems for you. So for you and others. So again, use your logon to identify the sample to you. The testing results, again, are very quick, and you'll get the results in your My Chart. Next slide. The dashboard is really a very helpful tool. We want everybody to, I think if you can get in the habit of looking at the dashboard, there's a huge amount of information in the dashboard. This slide looks at the student testing, and you'll see that we've coded this to show those students who are living on campus. We have just under 9,000 students living on campus, as well as the students living off campus. On the left, you can see how many tests are being done every day. It dips a little on the weekend, but then picks up and is very steady during the week. We're doing a couple thousand tests a day. And then you'll see the new student cases. How many students are positive each day? We've had a significant increase in the number of students that were picked up since the winter break, a striking number. On the next slide, I want to share with you really what we saw from winter break. And students came back. We had an aggressive testing program for them. We identified a fair number of students who, after winter break, came back onto campus and were, in fact, shedding virus. They were quickly moved into isolation housing. A few of the students who had remained on campus throughout the winter break also tested positive. We also have some students that are not yet coming back to campus, but are taking advantage of testing. And they are residential students, but not currently living on campus. I think what's important on this slide is to see the really significant drop off and how effectively we were able to quickly identify as people came back. And as we repopulated the campus, the rate of infection has dramatically dropped in the student body. And we hope we will be able to continue with this trend. Next slide. Here we have the wastewater sampling. This is a new feature that's in the dashboard. And you can see that every building that has a waste stream monitor is identified, and they're either going to be red or black. Black means it's being monitored and no virus has been detected, and red means that it is being monitored and a virus has been detected in the waste stream from that area. We have 76 monitors that are active now, and we'll have 200 in the next few weeks as we bring more monitoring on. Next slide. A really neat feature about this is that you can actually zoom in and you can actually find your building. And so the website is very interactive. There are a number of areas where this function shows up and you can get more detail. An example is like on the student information, you can look at each day and get the detailed information that's available for student positivity. You can also look at the rate of positivity and get the exact number of that day, how positivity for employees or for students. So take advantage and play with the website. The new wastewater feature is really cool. I think you'll really find it useful. You'll learn where your building is very quickly. You can check every day. Is my building positive or negative? So next slide, I believe we're going to be passing off to Gary Matthews, who's going to be speaking about all our efforts at mitigation. So Gary, please take it away.
We've heard about risk mitigation, and I want to stress that the face coverings are still extremely important, as well as the physical distancing. And there are changes that are occurring even as we speak in terms of the CDC and other county monitor their changes in the next several weeks that we're unaware of at this point. So returning to work, as an example, please complete the return to work training before returning to work. Sign your supervisor's training roster indicating you've read and understand your department's group's specific social distancing and sanitation protocols. Next slide. Next slide, please. Part of our risk mitigation is also being conducted by many of our staff. So thank you all for all that you do to keep the university safe. Facilities management has redirected staff to provide midday disinfecting teams and making sure that high touch areas are being addressed as quickly as possible. We've increased cleaning and disinfection programs with HVAC recent, and in smaller buildings we're working to see what else we can do. Um, 90% of those, please. I'm going to talk briefly about the indoor air quality. We have been monitoring indoor air quality, working with faculty across the campus to ensure that we have systems operating 24/7 to provide the maximum of air exchange possible for the systems. We're also routinely testing water systems to make sure that they stay healthy. Next slide, please. So I understand that I'm coming across poorly, my internet may be choppy. One thing I really want to stress is that we've had instances where we found people in buildings who did not belong. So one of the latest requests is a little bit of self-help, which is please do not prop doors open. All exterior building restrooms are accessible between 6 a.m. and 8 p.m. and they're going to be secured during the weekend. You can see in the slide, from sunset to sunrise, and after 1 a.m., the police department staff may also provide the service. So we urge you to stay safe, and most importantly, if you see something, say something. In terms of safety and security, we've been visited quite frequently by those that really do not belong on the campus. I will turn this over to Pierre, our CFO, at this point. Thank you.
Thank you very much, Gary. It's a lot of information that we have been covering, and if I was to kind of put it together and answer the question, how did we respond to the surge? I would say probably three things. One, not letting our guard down. We are continuing to do what we have done so far since the beginning of the school year, and it has been working for us. So let's continue the safety protocols. We also continued with our student housing program. Hemlata will talk about it a little bit more in very much the way we had it for the winter quarter, signals only, and a lot of social distancing. On the testing front, I think you got a good presentation here. We are maintaining we moved to a weekly testing requirement. As you remember, it was every other week back in the winter. We really try to improve convenience, and kind of Angela touched on that. We have also open testing to our entire campus community, so vendors are eligible for free testing as well to keep everybody else safe as well. Remember that we have the $65 test for families and friends and the community at large. We continue to expand the wastewater monitoring. I know there are questions in the chat to about 200 samples. The more granular we get, the more precise we are in our notifications to you. And then, of course, vaccination will be a big topic. Kind of three thoughts here. We are still kind of working through the frontline health workers in phase 1A. Chip will come back to that. The key, I think, for this country has been about efficiencies. There was a lot of vaccinations or vaccines received, but not enough made it to the patients. Our health system has been very much at the forefront with a 90% vaccination rate. So when we get the supply, we inject it. And that's why the county has been relying on UC San Diego Health to take over and operate the Petco Park Superstation, which is, I think, great for the country, the county, and for ourselves. And then a lot of questions I'm sure will come around when am I next? And here, again, we're letting kind of science and population health speak, and we have a committee of experts under the direction of our health CEO, Patty Mason, developing the vaccination plan for the campus as well, and we'll come back to that in that presentation. So please be patient, it's coming. On that note, Hemlata, I want you to speak a little bit more about winter quarter housing.
Thank you, Pierre. So on-campus housing and dining services remain operational. Again, we're making sure we have preventive measures in place. Just a reminder, on-campus housing and dining never closed. We have been in operation since last March when the pandemic first started. As Pierre shared, we continue to remain at single occupancy for winter quarter. In the event a student tests positive, as Angela shared, we did see an increase when students returned from winter break. We were able to detect it very quickly because students have to test on day 1, 5, and 10 when they come back to campus. So we were able to move them quickly to isolation housing, where basic needs such as food was delivered to the units. They also received care from Angela's team on a daily basis. For the winter quarter, our numbers are looking very steady. The university will continue to host approximately 10,000 students and their family members on campus. So the breakdown is about 6,100 undergraduate students, 3,000 graduate students, and 1,000 partner children of the graduate students. Dining will continue to be offered in a to-go model. In consultation with CHIP throughout the pandemic, on-campus dining never opened for in-person dining. So we have stayed closed, and we will continue to remain closed for indoor, in-person dining. Our students have been using the Triton to Go app, and about 95% of them use the app. So we're seeing very little time in terms of where students are coming in, placing the order, and waiting for their meal. They're placing the orders way ahead of time. For us, it is really important that we meet the needs of our students and really making sure that our decisions are based on health and safety of our students, employees. Again, we have a large number of employees that are on campus, but also our local community. So while keeping those considerations in mind, the next slide speaks to what we have really learned is that we have to be flexible, adapt, and comply with the public health orders. They continue to change, and our team is adapting as we get different requirements. Consistent communication with our staff, because again, information changes so rapidly. So we do have a weekly Ask HD8 forum, so our staff is able to get information very quickly on a weekly basis. We do have newsletters and some in-person if requested by our staff based on appointments. Now, as we also heard that we saw a surge in students coming back, we saw a little bit with staff, and so we are able to adjust service levels as soon as we see absences, but we have also made sure that we have not lost, say, a sight of compliance of safety protocols. We're fortunate that we were able to hire some TES employees that were able to assist with operational needs during the pandemic. Again, as you can imagine, additional cleaning, sanitation. And the last piece I'll add is it's been really important for us to support our staff to make sure they're completing their weekly test, and we make sure that they do that while they are still on the clock to make sure, again, our staff is staying safe, our students are staying safe. And with that, I'm going to hand it over to Chip, but happy to take questions in chat or during Q&A.
Thanks very much, Amada. I'm going to spend a little bit of time talking about where we are with vaccination. And I want to start by saying this is all changing rapidly, and I'm going to try to tell you what we know as of today. I have embedded a number of links that are places where updates are kind of being posted sometimes on a daily basis that will be pasted into the chat as we go so that you all can copy them if you want to be able to go back and check to see how things are changing. We'll also make this available to people in other ways if you have, if you don't pick it up in the chat. So let's talk a little bit about the different types of vaccines so that people who are asking which one should I get will understand kind of where we are. Right now, the only choice you have in terms of vaccines that have been approved by the Food and Drug Administration under their emergency use authorization provisions are two messenger RNA vaccines made by Pfizer and by Moderna. These are very similar vaccines that I'll discuss a bit more about in just a minute. The major downside to them is that they both require quite a bit of tender care in terms of their transportation, with very low temperature maintenance, or they lose activity, which has made it hard to get them way out beyond major medical centers and major facilities where -80-degree freezers can be found. So next slide. So what is a messenger RNA vaccine? People, I think, have been too frightened about this because they haven't really understood what messenger RNA is. Messenger RNA turns out to be essentially the instruction manual that our cells use to decide what proteins to make. We all have genes. Our DNA encodes our genes. And the DNA is translated into messenger RNA in the nucleus of the cells. That messenger RNA goes out to our ribosomes, where proteins are made in each cell. Next slide. And as the messenger RNA is read, shown kind of in this hamburger as the Swiss cheese, it's read by the ribosome, and based on the order of each of these nucleotides, the messenger RNA, the ribosome, is told to pick up a different amino acid to make a protein. So every protein in our body is encoded by messenger RNAs coming off of our own DNA. What a messenger RNA vaccine does is provides the ribosome with messenger RNA that says, why don't you make this protein for me? And the protein it's telling you the ribosome to make is the spike protein of the virus. The very one I showed you earlier as being very important for the virus to get into cells. And when we get a messenger RNA vaccine injected into our arm, all we're doing is telling a few cells in the arm, for the next 12 hours, I want you to read this messenger RNA that says, make this spike protein. Our immune system comes and sees that and then begins to become aware of what that is so that when you get exposed to the real virus, you have a head start. And that's all vaccines really are. They're a way to give us a head start on whatever bacteria or viruses we encounter. Next. Now the vaccines, the two of them, I'm just going to show you the data from the Pfizer-BioNTech vaccine, are very effective. They were studied in clinical trials that included tens of thousands of people, and both of them had almost interchangeable results. People were randomized to receive either the vaccine or a matching placebo. The Moderna vaccine is given twice, once on day 0 and another time on day 28. The Pfizer vaccine is given on day 0 and day 21. And in both vaccines, about a week and a half to 2 weeks after your first vaccination, people who got the vaccine began to have fewer and fewer new infections and become ill. And people who did not get the vaccine continue to become ill at about the same rate. At the end of the day, these vaccines are about 95% effective in preventing symptomatic disease and almost 100% effective in preventing severe disease. Next. Now, side effects we hear about. This slide is hard to read, but suffice it to say that both vaccines usually cause your arm to be sore. In the range of a flu shot, some people have a little more sore arm that lasts 2 or 3 days. Varying fractions of people, more younger people than older people, will have systemic symptoms of fever and so forth after this because their immune systems are more revved up and respond to vaccines in a more robust way. But these all subside within a 2 or 3 day period of time, and people generally tolerate it quite well. Next slide. Now, this just shows you the summary of the effectiveness from severe disease of the Pfizer vaccine. And you can see here that people who received the Pfizer vaccine after the more than 7 days after the second dose had only one severe case out of tens of thousands of cases cases with a protection rate that was as high, calculated to be as high as 99%. Next. Now, following, and these vaccines are the ones that you can get today. Following that, the next vaccines that will be coming up are vaccines made by AstraZeneca and Johnson & Johnson. These vaccines are made with what we call viral vectors. Next. And they do the same thing that messenger RNA vaccines do, which is to fool your cells into making the spike protein. But they do it in a slightly different way. They take an adenovirus, which is one that there are many different adenoviruses we get infected with very frequently. They disable it so it can't cause an ongoing infection. And they insert a bit of the viral RNA into the nucleic acid of the vector, so that when the virus gets injected into your arm, although the whole virus doesn't replicate, this RNA that is part of the, that encodes the viral spike protein is, and just like with a messenger RNA vaccine, you make the same viral spike protein. These two vaccines are currently in their late stages of development and will likely be presented to the Food and Drug Administration sometime in the next couple of weeks. And if they become available, they will be a big help to us for two reasons. One is they don't require as complicated a cold chain. And secondly, the Johnson & Johnson vaccine just requires one injection, which will be a lot easier logistically than the mRNA vaccines, both of which require two injections. And furthermore, these vaccines are very easy to make. They're not limited by supplies. We'll be able to make hundreds of millions of doses of these vaccines. So they will radically change where we are if they turn out to be as effective as the mRNA vaccines. Next. Now, what's most important is getting from vaccine discovery to getting into people's arms. And right now, we don't have enough vaccine to vaccinate everyone immediately. So there have been a lot of discussions about how to prioritize who gets the first vaccines so that we can, as effective as we can, prevent ongoing disease. The Centers for Disease Control has a committee called the Advisory Committee on Immunization Practices, and they met, they've been meeting continuously. They met most recently in December and felt that as vaccines become available, it was very important to vaccinate the healthcare workers so that people would have a place to go if they got sick, to also vaccinate what were called essential non-healthcare workers. And these are people who keep the food going, keep the lights on, make sure their transportation logistics are working, and are important in terms of managing wastewater and all the utilities. Having then vaccinated people who are essential to keeping healthcare and society going, they then prioritize people who are most likely to get sick if they do get infected. And this includes people who are older and people who have high-risk medical conditions. They came up with a schema which was probably more complicated than it should be, and this has led to some of the delays that we're seeing in getting vaccine that's ready to go into people's arms, because there has been this push and pull about whether we're ready to go to the next phase and where to send the vaccine. But I think with the new administration, you'll see a lot of this will be simplified. Next. Now these groups overlap, but where we are right now is we have enough vaccine from Moderna and Pfizer to vaccinate all the healthcare personnel who want to be vaccinated in the country. We haven't gotten through them yet because these vaccines are still being produced and we're still struggling to get up to this 20 million doses. Essential workers take another 90 million, some of whom are included in the healthcare workforce. Then we get into the other groups so that you can see here, we don't yet have enough vaccine for everyone, but vaccine is being produced at a steady rate and is gradually increasing. And as I said, if we can get to the point that these other two vaccines, the vaccine made by AstraZeneca and Johnson & Johnson, will have vaccine for everyone, I think, by early part of Q2. Next. Now, the challenge we have after that in deciding who to give it to is getting it to them. And the way the country has done so far, has managed this so far, has been that the federal government has said, we've discovered the vaccine and we've programmed the planes to fly it to you. Now you figure out how to give it. And the states have been trying to figure out how to give it on their own, following CDC guidelines. And each state then passes it out to counties, trying to provide amounts of vaccine that are equal to the county population, they're proportional to the county population and risk groups in each county, which gets to be a complicated challenge. San Diego County has prioritized the vaccines in a way that mirrors the CDC. This link that you can see here outlines how they've done that. Next. Where San Diego is now is we are vaccinating everyone in tier 1, 2, and 3 of phase 1. And this includes people who work in acute care hospitals, psychiatric facilities, nursing facilities, frontline paramedics, people work in dialysis centers, And you can see other healthcare workers, virtually healthcare workers all the way down to specialty clinics and people in private practice. This again, you can see this is from the county website. On the county website, you'll see vaccinating now, vaccinating next. Here's the link to that, so you can follow it as we move through the tiers. Next. We're also vaccinating now anybody aged 75 or over. And that's the first time we're moving out of this so-called healthcare essential workforce into the population of people most at risk to getting sick if they get vaccinated, if they get infected. As more vaccine is produced, then we will go down and be able to vaccinate people who are younger, 65 or older, people with risk groups, and finally to the general population when large amounts of vaccine are available. Next. And this is just a summary of what the county has on its website right now, effective as of day before yesterday. All healthcare workers and all those 75 or more can get vaccinated through the county vaccination sites, including the Petco Park Superstation. Now, this superstation is one that is sponsored by the county, but run by us, and is open to the public and open to people from UC San Diego. We'll be vaccinating soon those who are 65 or older and are beginning to move vaccine out into places like drugstores and other places. Next slide. Now, the complexity of it gets to be, how do we get vaccines to our own personnel? The state designated hospitals, particularly multi-center hospitals like us, in the same tier as counties, and we received enough vaccine to vaccinate all of our healthcare workers through UC San Diego Health, and that's been going on since December. And worked through most of the people from UC San Diego Health who want to be vaccinated. The vaccination rates have been very high. We are able to vaccinate so-called critical employees from the UC San Diego, and this would be people like police and firefighters through UC San Diego Health. And we can then vaccinate our employees through UC San Diego Health as patients through UC San Diego Health if they get their health care through us as we get to their tiers. So we can now vaccinate people who are 75 or more who get health care from us. If you're 75 or more and get your health care from Kaiser or other entities like Sharp, they will be calling you in to get vaccinated through them, or you can you can sign up to be vaccinated at the Superstation, which, as I mentioned, is administered by us, or some other county locations that I'll show you in just a minute. So all of these vaccine centers are operating in parallel in terms of going down through the tiers, but people can get vaccinated through their own healthcare systems or through the county based on logistics and convenience for them. Next. Now, how do you get signed up if you're a UCSD employee to be called in? It's being done through MyChart. And the way to activate MyChart is to go to this web location. It's pasted in the chat over here, and log in and create an account if you haven't already got an account, or just sign in if you're signed in. And you'll be getting an email that says you have a message from MyChart, which invites you to be vaccinated when your tier is reached. UC San Diego Health has got a large medical record system called Epic that knows how many people are over 75 and how many people have pre-existing conditions. It is being used to bring people into MyChart based on whether they've received healthcare at UC San Diego Health in the prior 3 years. The same sorts of things are being done at Kaiser or Scripps, although you'll have to go to them to understand more about the details of that. Next slide. If you go to the county, this again is on the county website. Please feel free to copy that link. And within this link, there are instructions for each of these county vaccination centers. And if you want to be vaccinated at one of them, you click on the instructions. And if you're in the tier that is currently being vaccinated or any prior tiers, it gives you instructions about how to sign up for an appointment. You can go there and sign up at your time and get vaccinated. Next. Okay, I think we're at an end of the vaccine section. I know there'll be some questions. And I want to emphasize again, new administration as of yesterday, things will change, but this is where things stand now. Our goal is to get everybody vaccinated as fast as we can with the least inconvenience as possible, as quickly as we can get vaccine available. And we certainly would appreciate suggestions and comments about how to have this be done in the least complicated way for everyone, because our goal is to vaccinate people as fast as we can.
Great. Thank you so much, Chip. It was great to kind of get the insider's view of some of that vaccination information. So I'd now like to welcome all of our presenters kind of back to the virtual stage here, and we'll start taking questions that were submitted both before the event and in the chat today. So vaccines were a big topic of the questions that were submitted. So I think we'll stay on that topic just a little bit while we're on the topic already. So let's check some of the questions that have been coming in. So here's a good one. Chip or Angela, I'll send this to you. Are people who are vaccinated capable of spreading the virus?
That's a great question. We know that they're capable of shedding the virus because in the original vaccine trials, and indeed in some of the people that we are continuing to test, we're testing everyone weekly, as you know, in the health system. We see viral shedding for several weeks after the vaccine, not from the vaccine because the vaccine doesn't contain virus, but from being exposed in the community. We know in the vaccine studies about 0.6% of people who got vaccinated were shedding virus when they were tested when they came in for their second vaccination. So we know that, and that was 3 times fewer than those who didn't get vaccinated. So what we know so far is fewer people shed virus. What we don't know yet is whether they shed as much virus. We're trying to develop that information now, both here at UC San Diego and also nationally. And my bet is we're going to find that people shed less virus, but we don't know yet whether it's enough less virus not to worry about transmission. So we're recommending people continue to be tested and that people continue to wear their masks and practice all the things that have kept us safe until we know more about it. But that's a great question. It's very important from the standpoint of stopping transmission in the community to know the answer to that question.
Yeah, that's interesting, Chip. Some of the questions that came in that we received was, speaking of, if you've been vaccinated, do you still need to get tested? So, Terri, I wonder if that's a question you can speak to. It did come in through prior to the event. So I've got my vaccine card. I've had both vaccines. Do I still need to do the symptom screening, the testing, all that stuff?
Yes, you still should do all of those things until you are told otherwise. As Chip has said, and as Angela has said, we're still learning so many things. And in the meantime, take all the precautions. Get the vaccine when it's your time, but also keep testing, keep masking, keep washing your hands, keep taking care of yourself. Please continue to do that.
Great. Thank you, Terri. So here's another medical question about the vaccine. How long will a vaccine last? Will we need to get it every year like the flu shot?
That's a great question. And that's one of the things that the vaccine manufacturers were asked to work with the government on to figure out. We'll find that out in 2 ways. One is we will continue to follow people who've been vaccinated and see when they start showing evidence of getting infected again. We know that people who get infected naturally can get reinfected as early as 3 months later. We know that immunity to coronaviruses decrease over time relatively rapidly, more rapidly than some other viruses for reasons we don't completely understand. So I'd be surprised if lifelong immunity is conferred by these vaccines. They do induce, on average, more immunity than than most people who just get infected with the real virus. So you're starting on average at a higher baseline. And so I think they'll protect people for a number of months. But I also think we're going to probably be vaccinating every year or 2. We will know more about that. It may turn out that people who are older and don't make as good an immune response early and who are more at risk for getting ill if they get infected would have to be vaccinated more often. And people who are younger may be able to be vaccinated less often, but those are things that are very much under investigation.
All right, so more information to come, hopefully. All right. You mentioned in your update, Chip, some information about side effects. So here's a question. Is the rate at which people are experiencing severe allergic reactions to the new vaccines similar to the rates for existing vaccines? So I guess how do the side effects compare to other vaccines that people might be familiar with?
Well, I think the arm soreness may be slightly more, not much more, but slightly more if you had a way to really objectively measure that without people knowing whether they got the COVID vaccine or a flu shot, for example. There have been a very, very small number of people who've had a anaphylactic response, and by that I mean a response in which they wheeze and they may have their blood pressure drop. It's the kind of thing you get. People who have shellfish allergies may get if someone slips them a lobster. And in that, you use an EpiPen and have to essentially resuscitate them. And we don't know what that's about yet. It's something that was noticed not in the vaccine trials, but when they began to use the vaccines in the UK. It's been seen both with the Moderna vaccine and with the Pfizer vaccine. My bet is it has something to do with some minuscule, we call them excipients, which are just non-active parts of the vaccine that were picked up in the manufacturing process as they went from small vats of vaccine being produced for the vaccine trials to these massive production lines for vaccine production. That's the reason why we ask people to stand around for 15 minutes after they've been vaccinated, so that if they have one of these reactions, we can take care of it. We're totally capable of taking care of it. We've had a few of these reactions down at the Petco Super Center, and they've been managed very well.
Great, thanks. Angela, I'm wondering if you can speak a little bit to the self-administered testing. And I'm wondering, I haven't taken one yet, but if I did, my first question would be, do you have any tips? Does the Q-tip have to go really far up in your nose? What can people do to have the best chances at getting an accurate result from those self-administered tests?
Great, Hallie. I think it works really well. And if you've had any provider-based testing, it's really very similar. You don't have to go more than half an inch up into your nose. It's 15 seconds though on each side. Make sure you do enough time on both sides, then right back into the vial. And those instructions are clearly there. If you're at all uncertain, what I recommend you do is book an appointment for a test at the Price Center, because there we have staff who are helping you do an observed test. Make sure you're doing it right. Get your confidence. That's what a lot of our students had been doing for a while. So they were very used to doing it. Do it that way once, and then you'll be fine and good to go. The really other important part is making sure you can scan your identity with your logon. That's a very important step so that we know it's Hallie's sample and not Chip's sample.
Great, thank you. That's a great service to offer, kind of the proctored self-administered test. All right, so this question, I think, Nancy, I'll send it to you first, but I'd be interested to know other leaders across the group on your thoughts about this as well. How will returning to work this summer look like for staff who have been remote? Will the vaccine be required before returning?
Yeah, that's a great question. So as we look at returning to campus, we have a number of things in play. We have the whole set of public health guidance and to be determined where we are with respect to the percentage of people who've received the vaccine and kind of the state of the pandemic. We also have actively in mind ways that we can think about more flexible work options where those are going to work well and where we may have actually demonstrated success through moving to remote work, so that we may be looking at instances of hybrid work options and other ways in which our return to campus might be a little different. And of course, that's going to depend very much on the operational needs and the specific type of work, because we have such a multiplicity of types of staff and types of work performed. And I would be remiss to not, of course, call out and thank the staff who have continued to work on campus every single day to keep our campus running. So we have just such a incredibly complex variety of types of jobs that I think the answer is hard to come by in terms of a single answer. There probably is no single answer. But in terms of the summer timeframe in particular, I think that was part of the question, Hallie. I think some of that will turn on what our likely forecasting is around the medical situation. And while I think it's also fair to say we truly don't have a crystal ball, but perhaps others who are on our panel have some sense of what that is likely to look like.
Great. Before we move on to another question, I wonder, do any of our other campus leaders want to speak to that?
One caveat is that the vaccines that are out now are available under emergency use authorization, which is a different provision of the FDA compared to commercial sales full approval. I suspect they'll be fully approved sometime in the next several months. But until they're fully approved, vaccines cannot be required. And so even if there were a medical reason to require them, that would be not something that could be done. Having said that, I've been, as a healthcare worker, I've been vaccinated, and I think these two mRNA vaccines are among the safest out there, and they're really highly effective. And so I would not, I think that so many people are going to want to be vaccinated. I hope we don't have to be in a situation in our society to say that we're dealing with vaccine conspiracy theorists thinking these vaccines are dangerous. These are really very good vaccines.
Thanks, Chip. And it's great to have medical folks like you and Angela who are able to speak to staff about just that and kind of go into the science a little bit. So we really appreciate that. All right. So Terri, I'm going to send this question your way. What's the latest with COVID leaves? Will they be extended?
So that's a great question. And we've been getting that a lot for our employee relations team. So the answer depends on what kind of leave you're asking about, right? So the easiest thing to do is to go to the COVID leave page to find out which leaves are available and for how long. So for example, the UC provided paid administrative leave, the Chancellor provided supplemental leave, and the Chancellor provided testing leave. As you can hear, our Chancellor really cares about us and keeps providing new leaves to make sure that we're all okay. Those leaves are all available through June 30th of this year. But the federal leaves expired in December of last year. We're still looking at what makes sense going forward. So any changes will be updated on that leave page. And Nancy always sends out in the CHRO update any timely updates on leave availability or anything else that we may have. So I would encourage folks to go there. The other leave that most people don't know about is like this Scioscia provided leave. Scioscia enacted some regulations that went into effect at the beginning of this year that give people another opportunity to have leave where we've excluded them from the workplace when all of their work has to be done in person. And so we will help answer any questions about those when they come up in those circumstances. They're very complicated. So we're here to help when that situation arises. But the key is to check that leave page and to reach out to your HR contact and reach out to employee relations, and we're here to help.
Great. Thank you, Terri. And I see my colleague Erica has put the link to that paid leave page in the chat if you want to check it out. All right, so again, another vaccine question, and I think this harkens back to what we were just talking about in terms of maybe hesitancy. So we've got a participant who asked, do you have any suggestions for talking with friends and family members who are nervous about getting the vaccine?
No, I think a lot of this requires people to see other people getting vaccinated and seeing what the results are at the population level. We're already seeing the number of cases among our healthcare workforce go down because we've been vaccinating them since December. And when we get these vaccines out in the general population, we're going to see the same thing. So people need to see that vaccines have an impact, and they need to see that they're actually been well tolerated in the population, and it will take some time to get there. I think that I'm not a big fan of fighting the last person to get vaccinated. We don't need to get, if we get to 60 with the new strain, probably 80% vaccination rates, we'll be able to, in the general population, keep the rate of infection down. The people who aren't vaccinated are still at risk and still get sick, but the general population will receive a lot of benefit even if we get to 80%. So I'd rather have the vaccine speak for itself and us speak for the vaccine than to get into a punitive situation where we're forcing people to be vaccinated in an adversarial way. Now, the caveat there is there are certain positions, jobs that because of what you do, you really can't afford to have somebody running around with COVID. One of them would be in the healthcare setting. There we really need to make sure that patients come in, know they're not going to be exposed to COVID by their doctors, nurses, and people working in the hospital. If you're San Diego Gas and Electric, you can't have people who are running the grid who get locked up for 10 days at a time running the grid having COVID. So there are job descriptions in which it can be a requirement for that job. But I'm hoping that people realize how well these vaccines work and how safe they are. There'll be very few situations where people will be so petrified about being vaccinated that they'll be reluctant to be vaccinated.
Great. So it sounds like just keep up with the news and kind of look for the evidence of how things are going. All right, so I'll pose this question to the whole group. What lessons learned over the past year will be applied to a return to a new normal post-pandemic? So lessons learned from this vast experiment of ours. Any thoughts?
I'll offer one to start, which is I think we cannot understate, we cannot, I'm sorry, we cannot, we let me just put it differently. We've seen such an incredible degree of innovation and collaboration with our staff, then we know that our staff are incredibly capable and support each other, and we have a community that is highly collaborative. So that is a lesson I think that we can hold very dear and take with us and leverage as we looking forward, build a reimagined workplace and draw upon the incredible strengths we have, and then look to develop even more strengths going forward.
Gary. Oops.
Yeah, I think certainly I agree with Nancy. I agree with Nancy, and most importantly, I think that the embrace of science has really shown the difference. And what makes UC San Diego unique is that, yes, we've all come together. We've had some very strong researchers, clinicians, practitioners, staff, you name it. Everybody's pulled together, and it's really the power of the team. It's the power of the whole. I also think that we're going to see new ways to design buildings in terms of how we structure offices and spaces. We've already started looking at some of those. We'll play through as the virus is better known. But I also think the remote work is here to stay. And as managers, we've been talking in my leadership group about what we're going to do in the future. I hope to see, particularly in my group, fewer people on campus every day. I think we've got to reduce the density. And we're going to be making sure that when we develop a position with Nancy and Terry's help, that we embrace remote work when we can. And it may be, alternating, it may be hybrids, just as was said, but I think we'll see new innovative ways. And quite honestly, from a selfish standpoint, that means less need for parking, which I love to hear. So I think that, we'll be in better moods in terms of people being able to work and interact with each other. So I'm optimistic.
Great. Anybody else before we move on to a different question? Terri.
I just want to say that what I've experienced has been inspiring on how much everyone truly cares for each other, looking out for each other in these difficult times, showing grace, getting to know people on a more personal level because of all of the things that went on last year that required you to really check in with people and finding more of the heart of who we are. That was the thing that resonated with me last year, and the thing I hope that really carries with us through this year and beyond, because it's beautiful to watch that within us.
Wise words as always, Terri. All right, so let's jump back into some questions that have been submitted. So Chip kind of one of the questions we got very frequently was, will staff be required to get the vaccine? And I think Chip spoke to it in terms of vaccine approvals, but I think I just want to call it out very directly, maybe have you speak to that, Terri, because it was a question that we got quite a few times and have also gotten today.
Yeah, so what's been out so far and it has been the system-wide approach so far and will likely continue at least for the time being, especially given what Chip noted, is the vaccine is not required for anyone. But for the most part, everyone is clamoring to get it, and we don't have enough of it yet. And we're doing our level best to make it available to everyone as quickly and safely as possible, right? So what I would say is, instead of focusing on the requirement, let's just focus on getting it to everyone who wants it, because there are so many, because that's the only way we're going to get to that, herd immunity. For, not just UC San Diego, right? For the city, the county, the state, the country, and the world. So I think we should just focus on that side of it instead.
Thank you, Terri. All right, we've got about 5 minutes left, just doing a time check for us. So here's another vaccine related question that I'll send to either Chip or Angela. So we've heard a little bit about antibody testing and heard that maybe they don't last as long as we would like them to. So here's a question. When will testing be available to know if you have immunity? Are there advances in that department? What's going on there?
Well, there are antibody tests now that you can get, but we don't know whether or not they correlate with immunity. In other words, the laboratory tests that we measure can tell us whether or not you have antibodies to the virus that can be demonstrated in the laboratory, but they don't tell us for certain whether or not when you get exposed to the virus, you will or won't get infected. These are called surrogates of immunity, and we figure that out over time in the population when we measure it in a lot of people and we see who gets infected. So while we have a lot of ways to measure who's been infected, they're not perfect, but they're pretty good antibody tests. We don't know whether a given level of antibodies will keep you from being at risk for being infected if you get exposed. So there isn't a specific test right now that you can go down and get and say, I'm good to go.
Thank you. That's a great answer. All right. So here's a question about the timing between the vaccines. Does the second Moderna vaccine need to be exactly 28 days apart, or can it be 26 days apart?
No, there's a window there. The way the studies were done, all these studies are done with 28 days plus or minus 2 or 3 days because the logistics are that way. So you don't have to set your clock and get there at exactly 28 days on the dot. You do need to wait that 4 weeks, but a day or two is not a big deal.
Great, thank you. All right, Hemlata, question for you. So we asked a little bit about kind of what the new normal might be post-pandemic. So I'd be interested to know, I know that you've shifted with dining and also, a lot of really different things with the way that students are experiencing living on campus. So I'd be interested to know, are we going to keep any of those? Has anything been surprisingly popular with students? So what does kind of the post-pandemic residence life experience look like?
Sure, absolutely. Haley, great question. I would say our students have adapted really well to the new normal, right? And I would say when I talked about the Triton to Go, that we have 95% of our students doing takeout orders. I think that is here to stay. I don't think that is going to decrease because I think students are seeing the value of you can order from anywhere and just come pick it up. There is no waiting. And I would say as our campus gets populated, I think it will also be really popular with our faculty and staff.
I would have loved to have room service in college if that had been, available to me. So I do not blame our students for loving that. All right, so 3 minutes left. And I just kind of like to open the floor up for any of our campus leaders. You've got a big audience. It was at one point over 1,100 staff. What do you want them to know? What's the big takeaway right now that you want staff to know before we wrap up today?
I guess if I were to say one thing is, even though the vaccine's coming, and as soon as we can get it to folks, we will work very hard to get it to all of our campus employees. But in the meantime, we've got a serious virus in front of us. And this new variant is also very concerning. So we need everybody to really stick to all of our strategies. The mitigation, the prevention strategies that Gary discussed, the testing, all the things we've put into place, they're really effective. If we all pull together and stick to the plan, we can get through this together.
I'd just like to add to what Angela said. I think we should recognize this has been a long time. People are tired. There's a high rate of just exhaustion, and we continue to see tragic outcomes from COVID. My next door neighbor just lost her son to COVID, and I hear more and more people whose lives are being affected, and we know 400,000 deaths in this nation. And so this is a time, I think, when it's all the more important to be vigilant, as Angela said, and also to extend that care and concern that we have for each other that Terri highlighted, and really think how we can support each other as a community, and how we can maybe think about in some ways transcending the hierarchical roles that we tend to have at times, and just think about each other as people and support each other in that way.
Hemlata.
So similar to Nancy, I would say it's really normal to have a lot of questions. And just know that everyone in campus leadership, campus roles are committed to answering those questions. So really not feeling the need to solve something on your own or answer the question, right? We just have great people on this campus that are here for all of us. So don't be afraid to ask that question, because if you have it, someone else has it as well.
That is definitely true at these town halls. I can tell you because I see the questions. Great. All right. If there are not any additional thoughts, we'll wrap up today. So just a couple reminders, please take the survey that you'll get for participating after the event. It helps us understand what topics you want to cover, what time of day is best for you. I also encourage you, if we didn't get to all the questions, which I know we were not able to today, you can find some of those, the most frequently asked ones, on the Return to Learn website at returntolearn.ucsd.edu. And lastly, I just want to thank our panelists once again for taking the time to spend with us today and providing such great information to staff about really important topics. So thank you so much for being with us. And with that, that'll wrap us up this month. Thanks, everyone.
Bye-bye. Stay well.